Hey guys, Tony Maritato here, a licensed physical therapist, and I'm actually sitting in my clinic with the BiodexRehab Reactive Step Trainer behind me because I've got Andy Simonson with me from BiodexRehab. So Andy, tell us a little bit about yourself, about kind of your background and what got you where you are today.
Sure. Thanks, Tony. I appreciate being here. So like I said, my name is Andy Simonson. I'm the distribution channel manager for BiodexRehab. My background is a clinical exercise physiologist, but then I've shifted over into the business realm. So best of both worlds, get to merge my passions for health strategy as well as bringing great equipment to private practice physical therapy professionals.
Nice. So Andy, you had some questions. We've had the Reactive Step Trainer here on site, I'm going to say a month. I don't even remember how long it's been. Go ahead, fire away.
Sure. So, Tony, we appreciate you demoing our equipment. And really what I just want to talk to everybody out there is, you've demoed it for about a month now. And, what do you see about it? What initial feedback for us, please?
First, I think the patients love it. It's one of those things where anytime you bring something new into the clinic, the patients are going to like it. We generated some buzz before it arrived. So I told all of my patients about it. I said, hey, we've got this new treadmill coming in. It's got gait training. It's got balance. It's going to try to trip you up. We're going to install a harness. I think just having the harness, like even if we didn't do anything else, just having the harness like brings a new dimension to therapy and what we do with our patients. But generally, it's been a really positive result. Now, we'll talk about marketing. We'll talk about some of the cash programs that I'm doing with it. But, I've been a private practice owner since 2002, not 2022. That's a lot of years. That's 2 decades. And over that time, things in the clinic get stale. I'm used to the equipment that I have. So anytime I have an opportunity to bring something new, it brings life, it energizes the clinic, it energizes the community, and gives me something new to kind of promote to, the city and the referring physicians.
Excellent. And kind of stemming on that, how do you feel that referral is going so far?
It's good. I'll tell you, we came to this location, we moved to Middletown, Ohio in 2006. We had our first clinic here in Middletown in 2006. We opened a clinic just down the road in Monroe in 2007. All of the local surgeons, primary care docs, specialists, they were all independent. Probably around 2017, 18, they all started to get acquired by the local hospital. And what we saw was a huge drop in our referrals from these groups once they got acquired by the hospital. They were just under pressure to keep the referrals in network. I totally get it from the hospital's perspective. But the idea with this is the hospital doesn't have a reactive step trainer, but it doesn't even have any kind of like balance program or specialty equipment. So once we brought this in, immediately I started reaching out to the referring docs. I said, hey, we've got this. It's from BiodexRehab. Everybody knows Biodex because it's been around forever. We're building this program specifically targeting patients who have challenges walking, have challenges with balance, but it's mainly for us, those patients that are in the gap. They're not bad enough to go into inpatient rehab or skilled nursing. They're still living independent in the community. They are falling, but they're not falling every day, and they're not getting hurt when they fall. A lot of my clients might fall once or twice a month. That's unacceptable, but they're still able to be independent with that. So once we brought this in, immediately we started telling all the local referral sources, hey, we've got this, we're gonna promote it, we want you to send patients so we can start using it.
Excellent. So maybe you can help shed some light. So the Reactive Step Trainer is really geared for balance and neuro reeducation for individuals with Parkinson's, either early stages or later stages, Alzheimer's, some stroke recovery, and any other neurological conditions that might impact the gait. So along with that, maybe you can shed some light on maybe any particular patients that you see are getting the most benefit out of this so far.
I'm going to go left when you guys went right.
Okay.
So I know you guys designed it for more of a neuro rehab. I'm not neuro in any way. Like if we get a patient, I do have one patient that had a stroke. Outside of that one patient, I would refer every one of my neuro diagnoses out to another facility. But that's okay, because the whole idea behind this is My specialty is total knee replacement. I get a ton of patients who had a total knee replacement who also have peripheral neuropathy, who also have difficulty walking, who also are maybe they're limited in their terminal knee extension and other things. So even from an orthopedic heavy private practice, I use this for everybody because everybody needs to walk. Gotcha. And everybody can walk better. And between the gait training functionality, the reactive step training functionality, truthfully, I don't know a single person. I mean, and I've shared videos. I've got young adults that are walking, that are using the tripping function and other things that love it, and they get excited, and you watch the video and they're laughing and giggling and it's making it fun. And I've got, 80 to 90-year-olds that are using it with severe peripheral neuropathy, and they're improving with it because it's giving them a controlled environment that we can really kind of tax the nervous system in a way that they're safe, but they're still working to maintain their upright posture.
Gotcha. Excellent. No, I appreciate that feedback. And maybe just one last question. So maybe talk to those that are maybe on the fence of purchasing new equipment. What other added value do you see the reactive step trainer bringing to other clinicians like yourself?
I think a big shift we see just globally, like not even just in our profession, but across all professional services, is the move into social media, the move into video and communication. And when I bring a new device like this into the clinic, I'm gonna make the money on the patient referrals. Like, that's a no-brainer. Medicare, Anthem Blue Cross, all the major payers, we're gonna have that income. But that's only a drop in the bucket, and that's only short-term benefit from my perspective. My perspective is I'm going to build a self-pay continuity program on this. So patients are paying anywhere from $100 a month to $500 a month just to come in and use the equipment. We're going to build specialized cash pay programs. So because my specialty is total knee replacement, we tend to get complex referrals of patients who had complicated outcomes. They're 6 months, 12 months, 24 months after knee replacement, and they're still not walking as well. We've got a $3,600 12-week program where they come in. This gives me objective measures. It shows me speed, duration, but it also shows me cadence and step length, stride length. I can get a lot of objective data from this that we can look at between the patient and the therapist to really see if we're making improvement. It's not a judgment call anymore. So what I'm looking at is, can I generate social media content that will bring extra money in the form of ad revenue, will bring extra money in the form of new referrals that I wouldn't have gotten, or will just help somebody on the other side of the world that is never going to be my patient, but they don't know that something like this exists. The social media aspect, the marketing aspect, the new physician relation aspect, and what I'm really hoping, and I think will happen, is it will give me something to attract new clinicians. Because anybody who's a private practice owner, we're struggling to find young, excited, or even, experienced, excited therapists who want to come work in a new environment. Sure. And so if there's new equipment with new technology, I really think that's going to give me the advantage over other local providers that we're all competing for the same therapists who are looking for a job. So that's what I'm trying to get out of it.
Well, excellent. Well, Tony, hey, thank you so much for giving us a little snapshot of our RST. Please contact Tony for some other one-on-one questions about it and how he's utilizing it, maybe a little bit more in depth. But if you have any questions, you feel free to reach out to sales@biodexrehab.com.